Erasmus Plus Project SMILE. Slow down, move your body, improve your diet, learn for life, and enjoy school time. What doping means? Doping is the use of performance-enhancing drugs, or PEDs, to improve an athlete's training and sports results. PEDs. PEDs have the ability or potential to drastically alter the human body and its biological functions, and to boost athletic performance. But what are the consequences? Now let's analyze the effects of performance-enhancing drugs, PEDs, on the human body. The main reasons why sport has taken the step of prohibiting performance-enhancing drugs, or PEDs, is the fact that these drugs are dangerous and potentially deadly, besides involving unfair play. Athletes who take performance-enhancing drugs put their health at risk, and most times, much more than they are aware of. On the WADA, World Anti-Doping Agency, list of prohibited substances and methods list, you can find answers to common questions about the health and safety risks associated with substances and methods. The list identifies the substances and methods prohibited in and out of competition, and in particular sports. The substances and methods on the list are classified by different categories, for example, steroids, stimulants, gene doping. Click the link to watch the list. Effects of PEDs on the cardiovascular system. Click the link below and watch the video. Anabolic agents. The primary medical use of these compounds is to treat delayed puberty, some types of impotence, and wasting of the body caused by HIV infection or other muscle-wasting diseases. Some physiological and psychological side effects of anabolic steroid abuse have potential to impact any user, while other side effects are gender-specific. Side effects. Physiological. Acne. Male pattern baldness. Liver damage. Premature closure of the growth centers of long bones in adolescence, which may result in stunted growth. Stunted growth and disruption of puberty in children. Psychological. Increased aggressiveness and sexual appetite, sometimes resulting in abnormal sexual and criminal behavior, often referred to as roid rage. Withdrawal from anabolic steroid use can be associated with depression, and in some cases, suicide. Effects on hormone levels. Click the link below and watch the video. Gender-specific, males. Breast tissue development. Shrinking of the testicles. Impotence. Reduction in sperm production. Gender-specific, females. Deepening of the voice. Cessation of breast development. Growth of hair on the face, stomach and upper back. Enlarged clitoris. Abnormal menstrual cycles. Click the links below and watch the videos. Side effects on males and side effects on females. Peptide hormones, growth factors, and related substances. The primary medical use of these compounds vary, but include treatment of cancer or aiding those born prematurely. Examples include human growth hormone (HGH), erythropoietin (EPO), insulin, human chorionic gonadotrophin (HCG), and adrenocorticotrophin (ACTH). Side effects. Physiological. Hypertension EPO/HGH. Blood cancers/leukemia EPO/HGH. Anemia EPO. Strokes EPO. Heart attacks. Pulmonary embolism EPO. Feminization HCG. Thyroid problems HGH. Physiological side effects of human growth hormone HGH. Severe headaches. Loss of vision. Acromegaly, protruding or enlarged jaw, brow, skull, hands and feet. High blood pressure and heart failure. Diabetes and tumors. Crippling arthritis. Beta-2 agonists. The primary medical use of these compounds is to treat conditions such as asthma and other respiratory ailments. Some studies have shown beta-2 agonists have performance-enhancing effects when consistently high levels are present in the blood. Side effects. Physiological. Palpitations. Headaches. Sweating. nausea, muscle cramps, nervousness. Diuretics. The primary medical use of these compounds is to treat conditions such as hypertension, kidney disease and congestive heart failure. Taken without medical supervision, diuretics can result in potassium depletion and possibly even death. Side effects: physiological, dehydration, muscle cramps, dizziness or fainting, drop in blood pressure, loss of coordination and balance. Stimulants. The primary medical use of these compounds is to treat conditions such as attention deficit disorders, ADHD, asthma, narcolepsy, and obesity. Side effects: physiological, insomnia, anxiety, weight loss, dependence and addiction, dehydration, tremors, increased heart rate and blood pressure, increased risk of stroke, heart attack, and cardiac arrhythmia. Effects of PEDs on thermogenesis and arrhythmias. Click the links below and watch the videos. Narcotics. In small doses, narcotics have medical uses that include relieving severe pain and inducing sleep. However, narcotic overdose is a medical emergency and can lead to respiratory depression and even death. While a sensation of euphoria and psychological stimulation are effects common to the use of narcotics, the misuse of narcotics can pose ethical questions about the handling of the substance as well as great health risks. Side effects: physiological, a false sense of invincibility, nausea and vomiting, increased pain threshold and failure to recognize injury, decreased heart rate, physical and psychological dependence, leading to addiction. Cannabinoids. Marijuana has a high potential for abuse and lacks accepted safety data for use under medical supervision. Side effects: physiological, increased heart rate, impaired short-term memory, slowed coordination and reaction of reflexes, diminished ability to concentrate, distorted sense of time and space, respiratory diseases, psychological, mood instability, impaired thinking and reading comprehension. Glucocorticosteroids. The primary medical use of these compounds is to treat allergies, asthma, inflammatory conditions, and skin disorders among other ailments. Physiological side effects: loss of muscle mass, weakening of injured areas in muscle, bone, tendon, or ligament, decrease in or cessation of growth in young people. Beta blockers. The primary medical use of beta blockers is to control hypertension, cardiac arrhythmias, angina pectoris, severe chest pain, migraine, and nervous or anxiety-related conditions. Physiological side effects: lowered blood pressure, slow heart rate, sleep disorders, spasm of the airways. Blood doping. Blood doping is the practice of misusing certain techniques and substances to increase the red blood cell mass in the body. Since the red blood cells carry oxygen to the muscles, this allows the body to transport more oxygen to working muscles and therefore can increase their aerobic capacity and endurance. There are 3 widely known substances or methods used for blood doping, namely, erythropoietin, EPO, synthetic oxygen carriers and blood transfusions *. The primary use of blood transfusions and synthetic oxygen carriers are for patients who have suffered massive blood loss, either during a surgical procedure or caused by trauma. Erythropoietin is used in the treatment of anemia related to kidney disease. Side effects: physiological, increased stress on the heart, blood clotting, stroke. With transfusions, there is an increased risk of infectious disease such as AIDS or hepatitis.